Groundbreaking has occurred for one of the most significant capital projects at Kootenay Boundary Regional Hospital. The Emergency Department expansion is a $19 million capital project. Funding partners include $11 million from the province through Interior Health, $7 million from the West Kootenay Boundary Regional Hospital District, and $1 million from the Kbrh Health Foundation. Our government partners are funding the bricks and mortar component of the project, and the Kbrh Health Foundation is purchasing state-of-the-art medical equipment for the new facility. The whole team at Kbrh is excited and ready to get involved in any way they can, for better or for worse. The Kbrh Emergency Department sees over 16,000 patients per year and is the regional intake center for the most critically ill and injured patients.
The Trail Emerge is certainly a hub for the hospital. Most of our sickest patients come through the emergency department, and we're certainly not going to refuse any patient in the hospital or coming from another hospital if they need any service from our emergency department.
The emergency department will triple in size to 11,000 square feet and will address current space and service challenges. The new emergency department is designed to segment patients based on acuity level.
Not only are we going to be increasing the department size so that we can offer our patients better privacy and offering our caregivers the room to do what they need to do, but we're also going to be significantly changing the layout. We're going to be streaming our patients in a different way so that we can triage those who need the most urgent care first.
The current emergency department has 6 curtain treatment areas, which poses challenges when considering patient flow, privacy, and safety. In our new emergency department, the 6 streaming and 6 acute care treatment rooms will all have walls and doors to maintain patient privacy and safety.
The enclosure of all treatment rooms with walls is an important first step in both ensuring patient privacy and improving infection control practices. The current curtain treatment spaces are inadequate and provide very limited privacy for our patients. They're also too small. In the new ED, the treatment spaces will be real rooms with much more space to work, as well as allowing for proper patient privacy. They'll also allow state-of-the-art infection control procedures to be put in place.
Patient safety and security is of critical importance at KBRH. The new emergency department will have an airborne isolation room for patients with suspected or confirmed infectious diseases and dedicated mental health consultation and secure rooms.
The airborne isolation room will allow us to safely manage patients with respiratory infections and reduce the chance of infection spreading to other patients or to staff. With the emergence of new infectious diseases, this type of facility becomes increasingly necessary. The mental health consultation room will allow us an appropriate space to care for patients and families in crisis. The secure room will make it much easier to care for the very ill psychiatric patient in a way that will better keep both patients and staff safe.
The emergency department will also have a 2-bay trauma room, fully equipped for adult and pediatric care.
Our current trauma room, we are only able to care for one patient at a time due to bringing the equipment and the personnel into the room. So when we do need a second trauma station, we have to set it up in the department away from the equipment, which is really less than ideal for the patient.
Other specialty rooms include a women's health room and a minor procedure eye, ear, nose, and throat room. The full suite of treatment rooms in the new emergency department will facilitate improved patient care for all of our community members.
The emergency department campaign is really important to our community because it will mean that they've contributed to this amazing project that's going forward at Kootenay Boundary. The benefit for our physicians and nurses is that they will have a state-of-the-art environment to work in. The benefit to our patients is that when they're at a very vulnerable time, they'll be seen in a really modern, equipped department that will benefit their experiences through the hospital.
We have had an overwhelming response to the emergency department campaign. To date, we are 40% to our fundraising goal with $400,000 raised. This is due to your generosity and commitment. Thank you for partnering with us to improve healthcare for all residents in the Kootenay Boundary.
And if you don't find a parking space, don't come crying to me. Thank you.
I had to wait for a student to leave their parking spot at the bottom of the hill, and I'm the head of the department.
It'll all be worth it.
Thank you for supporting the KBRH Foundation's Emergency Department campaign.
Thank you for your support.
Thank you.
Okay, say it after 3. Not on 3, after 3. 1, 2, 3.
Thank you to the donors for making this new emergency department a reality.
Oh, really? Say 1, 2, 3, and then we'll say thank you.
Thank you.
Thank you so much.
Thank you.
Thank you. Hey, that was good.
Really good. Oh, thank you.
On behalf of the Kootenay Boundary Emergency Department, thank you for supporting this campaign. It really means a lot to us.
As the manager of the emergency department and on behalf of our staff, we would like to thank the community for supporting us and supporting our equipment in this campaign. We're very grateful. Thank you.
The emergency department is the main point of access for all our community to our hospital. It's important that we have the best care available for everyone that needs our help. Thank you for helping us save lives.
All right, John, let's go to the ICU. Let's go. Oh, hey, oh, hey, don't take anything. Hey.
Thank you.